Welcome to Voices, a library lecture series. My name is Amira Aftab, and I'm the student representative on the Voices Committee. Today, we would like to begin with an acknowledgement that we are gathered on the sacred homelands of the Mohican people, who are the stewards of this land. Today, the community resides in Wisconsin and is known as the Stockbridge-Munsee Mohican Nation. We pay honor and respect to their ancestors past and present. Voices presents speakers on timely and enduring issues each semester to broaden and enrich the scope of studies at Hudson Valley Community College. Please fill out the surveys which are being passed around. They help us inform our programming each semester. Also, if you're here with your class, please make sure to reach out to your professors and fill in your lists. Today, Voices presents the Honorable Dr. Brenda Robinson. Dr. Robinson is a doctorate-prepared registered nurse who was born and raised in Albany, New York. She also considers Atlanta as her second home. She wears many hats revolving around community service, advocacy, and health. She has worked for the Veteran Health Administration for over 25 years and counting. She is also the City of Albany Human Rights Commissioner since 2013. She was re-elected citywide to a second term as Public Library Board Trustee for Albany. She is also president of the Arbor Hill Neighborhood Association. She is CEO and founder of the Black Nurses Coalition, Inclusive, which has a mission to eliminate healthcare disparities among individuals from minorities and low-income individuals. She's the first African-American board member of the Capcom Federal Credit Union. Dr. Robinson is a proud graduate of Albany High School, Hudson Valley Community College, where she obtained a degree in Associate Sciences as a registered nurse, and she also obtained her bachelor's degree in nursing from SUNY Institute Technology in Utica. She obtained her master's and doctorate in nursing at Walden University. In May of 2022, she graduated from SUNY Polytechnic with another MSN, Advanced Certification Family Nurse Practitioner, and ANCC Board Certified. She also received another doctorate degree in public service from Russell Sage College. Honorable Dr. Robinson is a public speaker and facilitator. She has held numerous health and wellness clinics around the capital region. She created the BNC Vax team, African American Vaccination Team, which was breaking the whiteness of the COVID-19 vaccinators and vaccine pods. Dr. Robinson and the Black Nurses Coalition are the primary applicant and the organization who was approved for a nursing-focused charter school to open in Albany in the coming fall of 2023. Dr. Robinson has a passion for freedom, justice, equity, and optimal health care for all. She has been selected as the Chamber of Commerce Woman of Excellence for Distinguished Career for May 2022. She was also awarded as the prestigious Henry Johnson Award, and 9/11/2021 was named after Dr. Brenda Robinson Day by the Mayor of Albany. She was honored as the city's most remarkable woman and was featured on Channel 10 for several months in 2021. She was honored by the Albany County legislatures for going above and beyond during COVID-19. Dr. Robinson has received many numerous awards during her entire time since Hudson Valley Community College and after. And with that, the Voices would like to welcome the Honorable Dr. Brenda Robinson.
Thank you so much for that wonderful introduction. It is an honor to be back here at Hudson Valley. Hudson Valley certainly has molded me and helped me get where I am today. First, I'm going to start off with a little disclaimer about real talk. About a year ago, around the same time, I did a presentation about healthcare disparities, COVID-19, and barriers that we encountered. One of the things I spoke about was having a trusted messenger. And it was a great presentation, and at the end of the presentation, we had a Q&A. And there was a healthcare official who got on the Q&A and seemed to be a little disturbed and a little frowned up and was saying to me, you mentioned that people of color, black people in your community, do not trust the healthcare system. The person mentioned some other things. It wasn't exactly what I said, but as I listened to her, I said, well, being that you said that, exactly that. No, people look like me do not trust the healthcare system, and that's a known fact. So I shared that just to let you know ahead of time, I'm about real talk. So we're not going to sugarcoat. We're going to take these rose-colored glasses off. We're going to put our best foot forward. We're going to straighten up and fly right, okay? You ready for that? That's what we can do? That's what we do, right? That's what we need, right? All right. Okay. We're going to talk a little bit about the injustices in healthcare, real talk, and power, because we always got to talk about the power that you all have to make change. So as we celebrate Dr. King's birthday last month, right, we often think about Dr. King and his I Have a Dream speech. It's so famous, so great, so inspiring. Langston Hughes, in his poem Harlem, spoke about a dream deferred. Does it dry up like a raisin in the sun or fester like a sore and then run? We must remember that Dr. King had more than just a dream. He put actions to his thoughts, action to his dreams. He put the work in just like I put the work in. We see racism in America festering like a sore for centuries. Racism has infested all aspects of our lives, including justice, employment, housing, generational wealth, and healthcare, all infested and supported by the foundation of racism. And Langston Hughes said, stinks like rotten meat. And by the way, if you don't know that poem by Langston Hughes, here it goes. What happens to a dream deferred? Does it dry up like a raisin in the sun? Or fester like a sore and then run? Does it stink like rotten meat or crust and sugar over like a syrupy sweet? Maybe it sags like a heavy load, or does it explode? Langston Hughes. We are told to know our past or we're doomed to repeat it. I've heard that, oh, know your history else you're going to repeat it. Unfortunately, when it comes to injustices in healthcare, our past is still our present. We're still living it. Discrimination and systemic racism prevails in healthcare as evidenced by, you nurses, as evidenced by poor health outcomes of people of color. So first, let's talk a little bit about social determinants of health, because sometimes it's hard to talk about injustices in healthcare when you don't mention anything about social determinants of health, right? Just so we're all on the same page. We have lack of access, underrepresentation of black people in healthcare, lack of cultural competence, even those who work each and every day and still don't make a living wage, substandard housing, stereotypes, microaggressions, micro-inequities, food deserts, bias. We deal with all these things. But you know what? We need to shine a light on it, right? We need to shine a light on it. We need to shine a light on all aspects of racism because it impacts your health and it feeds the injustices in healthcare. Redlining impacts our health. Racism in the workplace impacts our health, right? We need to have these. These are hard conversations to have, but we need to have them. Social determinants of health, when you think about it, what does that really mean for some folks in everyday life? Imagine being told to eat healthy, eat fruits and vegetables, when you barely have enough gas in your car to get you to work. You have your last $20 in your pocket. Payday, it's not till Friday, but today is only Sunday. And all you got is that $20. How much healthy eating do you think you're going to do? Imagine working 2 jobs, even doing some overtime, and not even making a living wage. These are some of the social determinants of health. Think about a woman or a man who new diabetic. Sit in your doctor's office and the doctor says, you need to exercise. Easy exercise for you to walk. Walk your neighborhood, walk around. I want you to do that. Well, heck, it was 3 shootings last night right on my block. Who's getting out to walk around there? Social determinants of health. Think about a person who worked so hard, saved money. You're going to buy a house in a neighborhood where there's less crime. But you're told, no, you're denied, right? But you're encouraged to buy a house around the corner from your apartment, and you approve for that. Redlining. That impacts us. That impacts our health. I personally have worked 2 jobs most of my adult life, so I know the struggle. I know it firsthand. But these are the things that we think about, and some people live when we talk about social determinants of health. So don't just look at the definition. Think about the people who are involved. So what are the injustices in healthcare we're talking about? Racism in healthcare. Why is this discussion important? We can't make any change unless we know what's going on. We need to have these conversations. We need to recognize the part that we all play. We have to be honest. We have to bring accountability. We can't continue to ignore and look the other way. We need to identify issues, reimagine, and reinforce our own power to make change. The same old is not working. You all can be part of the solution. But first you must discuss, bear witness, and take ownership of the problem. I know some folks are very comfortable with being part of the problem, but I know you all here today certainly want to be part of that solution. You at Hudson Valley, you definitely want to be part of that solution, right? All right now. Injustices in healthcare, unequal treatment, health disparities yields poor health outcomes for people of color, people who look like me. It breeds distrust, skepticism, lack of cultural competence, microaggressions, those biases, those stereotypes. And we talk about microaggressions, micro inequities. We talk about those things. Sometimes people say, well, you know what? What are you talking about, Dr. Robinson? Microaggressions are those things that people put forth to devalue you, but it's hard to put your finger on it, right? Like, I know this person is doing something to me, I don't like it, you're making me feel bad, but I really can't put my finger on it, right? Your supervisor's been knowing you for 5 years now and still can't get your name right, really? Microaggression. Those are the type of things we're talking about. Those are the type of things we're talking about. You're in a room, you're raising your hand, totally ignore you. Microaggressions. Walk in a room, whether it's a supervisor or someone else in leadership, and they frown. Microaggressions. They make you feel like you're not worthy, devaluing you. These are microaggressions. It happens in the workplace, it happens in schools, happens in colleges. These are the type of things that impact us, and we have to be aware of that. The biases, implicit, explicit, conscious, unconscious. You know I got to speak about that, right, when we talk about these biases. Just something I just want to say about biases. We put all these fancy terms, right? Implicit, unconscious. Well, most of the biases that I have experienced have been very conscious and very explicit. I probably got about 3 or 4 examples in my lifetime when I really felt that I experienced unconscious bias. The rest of the bias has been very conscious, folks, very conscious. So we try to make things like racism softer for folks who practice them each and every day and put these sweet little words, but we got to call it like it is. We're going to take them rose-colored glasses off, and it's going to be real talk. And when we do that, that's how we can empower ourselves to make change. If you're constantly looking the other way, change is not going to happen. And healthcare disparities have been going on for decades. You got to stop looking the other way. So Dr. King said, of all the forms of inequality, injustice in healthcare is the most shocking and the most inhuman because it often results in physical death. That's what Dr. Inequality, injustice in health. Well, when you have medical professionals arrive at a scene of a savage beating and do not immediately administer care, Tyree, that's injustice in healthcare. That's inhuman. When the maternal mortality rate of black women in 2000 was 22 deaths per 100 births compared to the national rate, which was 9.8. In 2019, 44 deaths, black women, per 100,000 live births. 2020, 53.3 deaths per 100,000 births, and we're speaking about maternal mortality rate of black women. This disparity, this injustice was inhuman in the 60s, because it went on in the 60s. It was inhuman in the 70s, went on in the 70s. Inhuman in the 80s, the 90s, and 2000s, and it is inhuman today. Is it still going on? You know, unfortunately, we hear reasons such as obesity, right? People tend to use obesity when they speak about, especially about black women. I'm pleasantly plump anyway, by the way. I'm not obese. They say, oh, lack of exercise, right? We start talking about this maternal mortality rate, right? But let's take Serena Williams, for example. She was almost a statistic. She's not obese. And how much more exercise would Serena Williams have to do to receive equal and fair treatment? If she's not exercising enough, I don't have a chance. Really, folks? Racism transcends wealth when you are a person of color seeking health care. And that's real talk. That's facts. And I need you all to help me with that, because we need to make change. We need to talk about racism in healthcare. We need to acknowledge it. We need accountability. We need change. We need you to get involved. The power of one, the power of many, we can make positive change together. Injustice. Breast cancer. My mother died of breast cancer at age 54. That was an injustice. Black women still have 4% lower incidence of breast cancer than white women. Yet, we die 40% higher breast cancer death than white women. That just doesn't add up. Doesn't even compute, does it? Doesn't even make any mathematical sense, but it goes on. Black women who develop breast cancer are less likely than any other race to be alive 5 years later after their diagnosis, regardless of when it was discovered. Are you hearing me? It's a health disparity, injustice, inhuman, and it continues, and it goes on and on and on. The American Cancer Society says, well, part of the reason the cancer death rate is not dropping because of not enough screenings. They also mention too few women are receiving timely and high-quality care. Those women they're talking about are black women. Injustices in health care. We need to pay attention. Racial bias in pain management. We got so many injustices going on in so many areas. Pain management. We start thinking about things like that. One of the first things that comes to my mind with that is, oh, Mr. Miriam Sims. Anybody know Miriam Sims? Anybody know Miriam Sims? We're in the Hudson Valley. I know somebody does. Dr. Sims? I'm using the word doctor loosely. Thought that black people did not feel pain in the 1800s, he butchered female slaves and did all types of GYN surgeries, heinous experiments on black women without anesthesia, with no regard to us. We said, the father of gynecology. No, the end does not justify the means. Think about that. Talk about injustice. You know what people of color have endured? Thinking about health care? And someone have a nerve to challenge me and ask me about what I said about people of color not trusting health care? Are you kidding me? No, not today. Racial bias in pain management continues. The AMA, Journal of Ethics, says that African Americans and Hispanics were less likely than white patients to receive any pain medication and more likely to receive lower doses of pain medication despite higher pain. And this is going on today, where people of color do not receive pain management at the level that white people do. AMA went on to say, African Americans and Hispanics were less likely than white people to misuse prescription opioids. I guess so. We don't get any. Duh. Yeah, we're going to be less likely to abuse it. We don't get it. These are injustices. Injustices. What about when you look at medical students and they still thinking that black people have thicker skin so we don't feel pain? That's an injustice. It's still going on. Where do they get that from anyway? Well, anyway, when you think about the AMA, for 100 years, the AMA, American Medical Association, did not recognize black doctors. Are you kidding me? 100 years? The AMA actively supported racism for over 100 years. Black doctors were excluded solely based on the color of their skin. This is the AMA we're talking about. Boy, this runs deep, doesn't it? AMA refused to support the Civil Rights Act of 1964. They remained silent despite the National Medical Association asking for them to support. That's the AMA. And you wonder why we're here today? They also didn't support the Hill-Burton Act. We wanted to amend that due to the fact that it had the separate but equal provision which allowed construction of segregated hospitals and facilities with federal funds. AMA was silent. Injustices in healthcare. How did we get here? This is some of the ways we got here. Injustices breed healthcare disparities. Blacks, African Americans are twice as likely as whites to die from diabetes. Blacks, African Americans, 3.2 times more likely to be diagnosed with end-stage renal disease compared to whites. These are injustices. Blacks, matter of fact, I don't mind being called black. Blacks, African Americans are 2.3 times more likely to have a lower limb amputation as compared to whites, Caucasians. Blacks, African Americans, diabetic death rate, 39.8 compared to whites at 18.9. Do you understand when we start talking about injustices? Is some bells ringing? I hope some bells are ringing. You know, when we talk about COVID-19 and the disproportionate impact that COVID-19 had on people of color, people who look like me, we started talking about healthcare disparities, and I just want to make it clear, healthcare disparities did not start with COVID-19. Shed the light on it, but certainly it didn't start there. Justifiable skepticism and mistrust of the healthcare system. I've been speaking about that. It's not just a Tuskegee experiment you may know about, the maltreatment of black men during the so-called experiments with syphilis and things like that. Skepticism, mistrust, black people in healthcare, ongoing. It's a day-to-day, the day-to-day racism and stereotypes that we endure each and every day. That maltreatment is constantly reinforced. That's why we have forums like this, so that you can be enlightened, so that you can be empowered, so you can say, you know what, we got to make some change. I think I can do it. That lady over there with that afro said I have some power, I can make some change. I think I can do it. I think I can, and you can. Accountability is imperative. purposeful work is needed to repair the damage and to build trust. You have the power to make that positive change. But it takes action, not just words. You can stand up here and talk all day. I'm going to do this, I'm going to do that, yada, yada, yada. We need some action, folks, some action. You guys are so young. Some of you are so young here, eager. I know some of you can make it happen. I just know. You know, we've had horrible things happen. You ever heard of eugenics? If you haven't, I want you to look it up. Forced sterilization of black and brown women? Come on. You talking about injustices? Inhuman. And some people say, oh, that happened a long time ago. I remember when I was pregnant with my first daughter. That was in the late 80s. Had some GI issues. First thing the doctor said to me, well, maybe it's the second thing. I hope he said hi to me. The second thing he said to me was, oh, you're having these problems. You should get an abortion. Really? When you start talking about sterilization, it's way back then. No. Well, my mother was there. It's a praying woman. My grandmother was there. She's a praying woman. Oh, no, we're not doing that. No, sir. My oldest daughter graduated from Albany High, scholarship to Union, has 2 master's degrees, is married, teaches in Atlantic public school system, is an instructional coach. Thank God. Thank God for a praying mama. Thank God. So when we start talking about these things and thinking this way back then, no, it's not. And we need to change the mindset of folks. We need accountability. We need to stand up and say no more. We need to start getting outraged with some of these things that's going on. We talk about lack of access. Please don't be misled. A brick and mortar building, like I always say, with a sign on it that says clinic, or an open sign does not mean access for all people. It just doesn't. In the old days, they could put the sign up, whites only. Remember that? You're going to hear about it all month of February. Remember that? Whites only? Well, now you got to be more creative. Just can't do that anymore. You got to be very creative. You do things like, oh, we don't accept your insurance. We don't accept Medicaid. You do things like, I need you to pay your copay before I even see you. You do things like, oh, you need to see a specialist, but he don't accept your insurance, or the copay is so high that you can't even go there. Okay? Lack of access. And when you don't have cultural competence and the person does not know how to relate to a person, that's lack of access too. If I go to the doctor's office and you're not even speaking in a language that I understand, or you're not even taking the time to explain anything to me, am I coming back? No. Lack of access. Think about those things. Even in your day-to-day lives, think about those things. Lack of diversity in healthcare. Diversity in healthcare is imperative, especially as our world is not becoming more diverse. It is diverse. Lack of diversity. That's a huge barrier. We need to increase racial diversity in healthcare, and not just at the bedside, in leadership positions, decision-making positions. Who know us better than us? We have to do it. I looked at some of the stats from the National League of Nursing 2020. RNs, only 6% are black, 81% Caucasian. Hey, we need to make some change. We need to make some change. We do. We do. Faculty, one of the things that we have to look at, right? One of the things that we have to look at is these schools, even Hudson Valley. Look at your faculty. Look at your nursing faculty. 9% of full-time nursing faculty is black. Only 3.4% Hispanic, 2.9% Asian. We have work to do. And this is across the board. We have work to do, right? And I think we have power. We can make some changes. We can do things. Heck, we got a new high school coming in Albany, Nurses MC, focus on nursing, right? Got our new principal sitting right back there. Yeah. We have the power. We can make change. Colleges, what does change look like? For me, college leadership being open to change and commit to diversity for students and faculty is a must. Perform an honest review of your curriculum. Don't let somebody like me come and meet with you and talk about diversity and you say you're going to get back to me and you don't. That's not a good thing, because I'm going to call you out, okay? Nursing programs must address the whiteness in nursing. I had an opportunity, I met with some folks here, and I had an opportunity to speak with some nursing students, and it just happened to be the nursing club that I was given the opportunity to speak with. And I spoke about the whiteness in nursing. I spoke about some things, and they said, oh my God, I never thought about that. I said, you ever think about when you're in nursing school, you go to your clinicals, and you're always taught how to take care of a white person? You ever think about that? They said, I said, well, let's talk about it. You go into the room. It's a Caucasian person there. You got to make sure the room is neat. At least I had good instructions from Hudson Valley. I had to make sure that room was neat and everything, okay? Your corners better be right, all of that. So you make sure all that. You look at the patient, right? My clinical instructor, if that patient's not looking good, it's a problem. Hair has to be nice and all that, right? But with that same type of motto, when it was a black person, you didn't have to do a thing to their hair. You didn't have to address that at all. Their hair can have been all over the place. You never, and you're fine. Oh, you're a wonderful student today. And the person is looking a hot mess. A hot mess. These are some of the things that we don't think about when we think about the whiteness in nursing, right? The whiteness in healthcare. I was a patient before. I'm sitting there at my little afro at the time. Wanted to do my hair. They gave me this little comb. What's that gonna do? Huh? That was good for Sally and other bags. It ain't gonna do a thing for me. Whiteness in nursing, whiteness in healthcare. These are some of the things that we don't think about, but we need to talk about. I'm there ashing, you give me some water-based lotion. What is that gonna do for me? I need some oil. These are the things that we have to talk about. These things are important, right? Think outside the box. Think outside the box. We have to do it. We have to make purposeful change. We have to use our power. You have the power to make change. Healthcare institutions, what does change look like there? We need healthcare institutions, healthcare systems, clinics, and oversight bodies to be willing to address their own biases. If we all have them, I need you to address your own biases. We have to. Increase diversity in their leadership and decision-making positions. There are many qualified people of color. What's the problem? I just don't understand that. What's the problem? Take a good look at their delivery system and their patient minority health outcomes, and stop accepting or making excuses for disparities and injustices. I hear so many excuses. Somebody's like, here we go again. I feel like I'm in Charlie Brown with that teacher. Come on. Come on now. You know there's a lot of work to be done in healthcare when I was just speaking about the AMA and their 100-year behavior, right? So we have a lot of work to do. We can do it. We got to just get started doing it. We just can't keep looking the other way. Stand up. Harness your power. So as we seek to make change and harness our power, we have to mention funding, right? So I mentioned about Dr. King and his quote of all the forms of inequality, injustice in healthcare is most shocking and the most inhuman. But the sentence before that says, we are concerned about the constant use of federal funds to support this most notorious expression of segregation. So we always have to take a look at funding. Time and time again, demographics of poor folks, black and brown folks, are used to get funding, right? You get all this funding from the way that we suffer. You get funding, but that funding does not trickle down to our communities. And that's an issue. If we continue to get all this funding and healthcare disparities are still here, isn't there a problem? I know it's not just me now. If we keep getting this money and the money's supposed to be helping me out, and you're using my problem to get the money, why do I still have this problem? Year after year, decade after decade, century after century. Something's wrong. Something's wrong. We need to hold someone accountable. If our stats are consistently poor, our health outcomes are consistently poor, what are you doing with that money? What's going on here? And are we, people who look like me, going to continue to sit back and say, okay, yeah, you can use me, yeah, here, yeah, I'm going to join this survey, yeah, yeah, you can have my social security number, yes, yes, yes. Oh, yeah, I'm coming down there, yes, 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 yes. No, 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 no. That funding is not trickling down when we continue to see billions of dollars flow, and folks who look like me still have those same poor outcomes. Where's the accountability? So when you start talking about injustices, you make sure you're looking across the board. You know, I've heard time and time again that the United States spends more money in health care than any other country, yet we have the poorest outcomes. That's noted by many sources. We need some accountability, folks. We need some accountability. The U.S. has the highest rates of deaths from avoidable or treatable causes and the highest maternal and infant death rates, especially for black women and black babies. Injustices. And we don't need to just look at these injustices in February. We need to look at these injustices every day of the year because we need to work on this. We don't need a report from CNN or the Commonwealth or any other entity to know we are living shorter lives, we are less healthy, and the health system is not working for people who look like me. So take those rose-colored glasses off, use your equity lens. You have the power to make some changes, right? Those of you who are in powerful positions and you're at the table, take a stand, demand change. It helps us all. You know, when we use those ERs and do all these things, it impacts everyone's pocketbook, okay? Those of you who are working your way to the table, in whatever station you are at in life, make a change, take a stand. You have the power. For me, I'm open, honest, straightforward in some instances. I had to not only bring my seat to the table, heck, I had to bring my own table. It's all right. It's all right. We can make that happen. We can do it. It can be done. Let's think about the BNC vax team. When there was no vaccinator, you're sitting there looking at people of color, people who look like me, stacked up high, dead, piled high. We're watching this on the news. Black people disproportionately impacted by COVID-19. You go to a vaccination site and everyone's white. Something's wrong. I know plenty of black nurses. What's going on here? Reached out, reached out, reached out. Remain the same. What did we do? Created the BNC vaccination team, ran our own sites. You have the power. You can think outside the box. You can do these things. You can. And I need you to do that. Advocacy, that's important. Being a strong advocate to defeat the injustices. No matter where you are in life, you have the power to be a strong advocate. That power, that advocacy, may be supporting a local community-based organization. It may be attending a meeting or rally. It may be supporting a particular policy or policy change. You may be the one who introduced a policy or a change. You have the power to do that. You don't have to sit back and just accept. You have the power to make change. I refuse to let dreams of health equity dry up like a raisin in the sun. We all know the issues of black, white, and racism. We know that. We know that exists. But sometimes I don't think we take the time to see how devastating racism is across the gamut. Sometimes we don't take time to look at that and think about that. Sometimes even people in power don't take the time to realize the impact that they have on other people. I think we all need to stop and take a good look at that impact. Racism in healthcare is real. We have to take those rose-colored lenses off, see things with an equity lens, be willing to step on out there and do the right thing. We can read about poems, we can read about Dr. King, we can read about all these different things, we can talk from now to next year, but unless we're willing to put action to our words, we're going to continue century after century having these healthcare disparities. Who in here think they have the power? Anybody got power to change? Do you have power to make change? Do you have power to make change? I hope you do. Especially if you're a student here. Especially if you are an instructor here. Now, I know you have the power. Hudson, and let me tell you about power, and I'm going to go after I tell you about this. Hudson Valley. I'm going to tell you about power. 4 children, working hard. I already told you about the 2 jobs I had all the time. Sometimes I had 3. I worked as a CNA, LPN, and things that I wanted to do. I needed to be an RN, right? Can't keep running around here and this lady telling me this and telling me that. I need to be the boss sometimes. I need to get this RN. I'm the LPN running around doing all this work. Looked at these schools, right? I didn't have a lot of money. How am I going to get this RN? Right? I took the power in my hands, researched, and Hudson Valley did that for me. I didn't have money to go to a 4-year college and say, oh, yeah, I'm just going to chill. I'm going to go here and go get this bachelor's. I have it like that. I'll probably even stop working, being a stay-at-home mom. Nothing wrong with stay-at-home moms. I just didn't have that choice. But Hudson Valley gave me a choice to be successful and get the education and foundation that I needed, right? I didn't just sit home and say, oh, well, I can't do it. No, I can do it. And Hudson Valley helped me get there. Does Hudson Valley have some issues? Yeah, that's why I'm always knocking on the door. Hey, what's up, Hudson Valley? What's up with this diversity? We need to get going. Go, go, go. But I really think institutions like this, because we need all types of institutions, because they are folks like me who need programs that Hudson Valley offers, right? I want to thank you all for listening to me. All right, do we have any questions for me? Anything? Any questions? Do you powerful people have any questions? I have one. Who's going to make a change? Anybody got a change in mind they want to make? No one got to change? No one got any thoughts? No one got any plans? Because we got new school coming. That's a big change. Any of you students?
Where do we begin?
Where do you begin? Well, you began by showing up here and listening to me. That's a good start. Are you a student?
I am.
What are you studying?
I'm looking to get into the nursing program this coming fall.
Oh, perfect. I'll get your number. That's what I'm talking about. Give me my hand. I got to get your information. So you have made a good start already. And I certainly have to get your information. Taking a good look at where you want to be and where you want to go is a great start. It is a great start because you have to start from somewhere. And that certainly helps you harness your power. Definitely. So you're doing something great already. That's what I'm talking about. We need you. Anybody else? Who else doing something? Who else got a thought? Who else got a plan? He got a great plan. No more great plans out here? Yes.
So I'm currently working in healthcare right now as well, and
Well, thank you so much, and thank you. Did you hear her? She's being an advocate. That is so important, being an advocate and being in healthcare. Certainly. Thank you for that. Thank you. Anyone else? Anyone else? Dr. Burkhart, did you have something to say, doctor?
I can point out that what you said about the AMA was also true of the American Nurses Association. That wouldn't let black nurses in until 1951, and that the U.S. Army would not enlist black nurses at the beginning of World War II.
Yes.
So there's a lot to overcome.
A lot to overcome. I can talk all night about racism in healthcare, but we can't be here all night. But I certainly thank you all for having me. It's just a pleasure to be here. Hudson Valley is just expanding. It's beautiful. Loving it. Loving some of the changes. Still got to grapple with that diversity. We're going to work on that. And thank you again for having me.